Good night, everyone. I'm student nurse Caris Branch, and I will be showing you the different types of injections. First, we start off with our medical hand washing. Then we begin our procedure. The first type of injection I will be showing you is the subcutaneous injection. First, we will be injecting 100 units of insulin. First, we open the insulin. Then we clean it with the alcohol pad. Then we take the insulin needle, the one with the orange top, the 100 units. We will be injecting the insulin subcutaneously. So we pull the needle back to 100 and we aspirate the vial of insulin. And then we pull back slowly. We make sure there is no air in the needle. And for protective purposes, we put the cap back on without touching the tip of the needle. Then we label the insulin. We label the date it was open. We label the expiry date, and we label how much that was taken from it, which would be 100 units. Then we put on our gloves. Which is called donning. We put on our gloves because during injections we might come into contact with some bodily fluids. Okay, now we clean the patient with the alcohol wipes. And we wait for it to dry. Then we pinch the skin, and then we go in at a 90-degree angle, which should be straight ahead, and then we slowly insert the medication. And this is subcutaneously. We then throw the needle into the biohazard bin. We do not cover it back to avoid risk of puncturing ourselves. Then we wash our hands again. I will do this off camera. Now we will be injecting tuberculin intradermally. This is the tuberculin needle. After hand washing, this would be the tuberculin. So we open the vial. And we clean it with the alcohol swab. We open our needle. The doctor has ordered 0.5 milliliters of tuberculin. So we pull the needle back to 0.5 and we aspirate into the vial. And then we pull it back and we pull it back slowly in order to avoid air from entering into the syringe. This is 0.5 milliliters of tuberculin, and this will be administered intradermally. So we go to our patient and we wipe them with the alcohol swabs. We wait for it to dry. We do not fan it at risk of putting pathogens into the spot, and we inject at a 10 to 15 degree angle. And when we inject, we should see a small lump like a mosquito bite appear. See, there is a small bump. I don't know if you could see it, like a mosquito bite on the orange right here. So we do not rub the part that has been injected, because that may cause irritation, and then we throw the needle into the biohazard bin. Then we wash our hands again. Before we wash our hands, we document that we have given the patient 0.5 milliliters of tuberculin, and then because the vial still has fluid remaining in it, we put how much fluid we have taken out of it. We put the date it was open and the time, the date of expiration. Then we wash our hands. I will do this off camera. Okay, now we will be doing an intramuscular injection, but first we would have to constitute Rocephin. So we would open the vial and we would clean it with the alcohol swabs. The label on the back says that we would have to add 5.6. The doctor ordered 500 milligrams per ml, and the back says you would have to constitute 5.6 ml of dilute in order to make this 500 milligrams per ml. So we take our needle, we put it to 5.6 ml. And we aspirate. Okay, now we constitute. Then we mix it all together. Then we aspirate again. Okay, and now we do an intramuscular, and the needle for intramuscular has to be longer so that it can meet into the muscle. Now we go at first, we put on our gloves after hand washing. And then we wipe the patient with an alcohol swab. We wait for it to dry, and then we go in at a 90-degree angle because the needle is long enough to reach the muscle at a 90-degree angle in a fast motion. When we do this, we aspirate to see if any blood will come up. If we aspirate and blood does come up, that means we are not in the muscle and we need to pull out the needle and start again. But there is no blood coming up, as you can see, so we just continue with our injection slowly. And we're finished. Then we label the dilute and we say how much has been taken out of it, the day that it was opened, and the amount that was taken out of it. We document that the injection was given and sign our names, and we wash our hands, and that was the end of the demonstration. Thank you.